of the STT segment on the ECG is due to other reasons. So aim to compare the results of computed coronary angiography with the conclusion of the pretest probability of chronic coronary syndrome in patients with abnormalities, microvascular disease, non-obstructive or obstructive atherosclerotic disease, materials and methods. Our study was conducted on the basis of the Rostov Regional Clinical Hospital with the participation of 50 patients aged 40 to 67 years. Inclusion criteria: chronic coronary syndrome with evidence of pain. Before starting the study, each patient is assessed for the pretest probability of chronic coronary syndrome. The main anthropometric indicators were evaluated: body mass index, waist circumference, hips, conducted ECG, ultrasound of the heart, BCA, Holter, and most importantly, computed coronary angiography. If necessary, disable coronary angiography was performed within 1 month after spiral computed coronary angiography. Computed tomography data of the atrial bed were studied using Excel section. The evolution of the lumen of the coronary arteries was performed by segment according to the classification of the Society of Computed Tomography Specialists. All patients divided into 5 groups: patients with muscle bridges, storage and initial stenosis, moderate and severe stenosis without atherosclerosis, and anomalous hypoplasia of the coronary arteries. The obtained data were processed in the application program statistic VERSA-12 using such enrichments and Shapiro-Wilk, Mann-Whitney, Chi-square Pearson with the Yates correction, set of statistical estimate with p less than 500. So results. On detection of spiral coronary angiography in patients with muscle bridges, found initial stenosis. Conclusion: coronary angiography showed a low probability, the test moderate high. The second group, initial stenosis, were detected to a greater extent in the anterior interventricular artery. Conclusion: coronary angiography showed a low probability, the test moderate high. In group 3, moderate stenosis were found in the left and right coronary arteries, anterior interventricular and circumflex arteries, severe stenosis of the anterior interventricular and circumflex arteries of the right coronary artery. Conclusion: coronary angiography showed a moderate high probability, the test high. No calcifications were found in the group with coronary artery anomalies. Conclusion: coronary angiography showed a low probability, the test moderate. Dear colleagues, please look at the general table. In group first, male patients predominate. The pressed probability within the proportion differences was moderate to high. Transient depression on the STT segment in group 1 is more common than in group 2. Group 2 was dominated by patients with moderate pretest probability. Group 3, patients were found to be older than those in other groups. Compared with the detection of initial stenosis, women were more common in the third group. Predominate apical pain syndrome, patients with high pretest probability, and the third group more often than in the first and fourth groups, there was atherosclerosis in the carotid arteries. A feature of patients with clean arteries is a higher incidence of exacerbation of pain. Pretest probability in group 4 and 5 was more moderate. Discussion. I'd like to know as follows from the results of the study: computed coronary angiography made it possible not only to identify patients with the risk of developing coronary complication, but also to conduct differential diagnosis on an outpatient basis without resorting to an invasive method. In our study, a large number of patients with muscle bridges were found. According to the literature, there are large differences in the frequency of their detection. The prevalence of muscle bridges varies considerably from 4 and 60%. This widespread can be explained by different generation of tomographs. As follows from the literature, with computed coronary angiography, the probability of detecting muscle bridges is higher than with traditional coronary angiography. The need for coronary angiography after computed coronary angiography was low in our study, which avoided additional financial costs associated with hospitalization and possible complications associated with the invasive procedure. In 4 cases with a low pretest probability, coronary atherosclerosis was detected, requiring treatment. In 28% of cases, transient depression of the STT segment was not confirmed by finding on computed coronary angiography and was due to microvascular lesions of the coronary arteries, and in 1 case, mitral valve prolapse. Thus, the table of pretest probability of chronic coronary syndrome doesn't allow to reveal the differential diagnosis and evaluate the nature of the manifestation of coronary arteries in accordance with the result of computed tomographic coronary angiography. Wherein my personal contribution to the work, ideation, drafting of the manuscript and presentation of profit for the International Conference on Clinical Cardiology and Congenital Heart Disease 2022. I'd like to note that spiral computed coronary angiography was performed of our patient as part of compulsory medical insurance. This is free of charge. Therefore, it's possible to prescribe this examination method free in your clinic. We strongly recommend using it instead of routine methods. Thank you for your attention. And if you have any questions, you can contact my mail. I write it in the chat now.
Thank you, Dr. Nasytko. That was an excellent presentation. Hope the participants have learned and benefited by sharing research work. Does anyone have a question? Please write down on the chat box.